1. What are the three main pathologic mechanisms of cerebrovascular diseases? Thrombotic occlusion, embolic occlusion, and vascular rupture. 2. List the risk factors associated with cerebrovascular diseases. Risk factors include age, sex, hypertension, diabetes mellitus, cardiac diseases, lifestyle factors, alcohol, tobacco, physical inactivity, obesity, and more. 3. What changes occur in brain circulation due to hypertension? Chronic hypertension leads to impairment of autoregulatory mechanisms and can cause hyaline arteriolar sclerosis in deep penetrating arteries and arterioles. 4. Describe the pathological lesions in the brain associated with hypertension. Pathological lesions include massive intracerebral hemorrhage, lacunaire infarct, slit hemorrhages, and hypertensive encephalopathy. 5. What are the common clinical manifestations of hypertensive brain disease? Clinical manifestations can include alterations in consciousness, severe headaches, and increased intracranial pressure. 6. Outline the pathogenesis of brain infarctions and their progression. Brain infarctions can be ischemic or hemorrhagic, and their progression involves a series of changes from acute to chronic stages, including necrosis, inflammatory responses, and repair mechanisms. What are the different types of intracranial and cerebral hemorrhages and their causes? Types include extradural, subdural, subarachnoid, and intracerebral hemorrhages, each caused by different factors such as trauma, hypertension, aneurysms, and more. 8. What are the microscopic and macroscopic changes seen in ischemic infarction? Microscopically, early neuronal changes with neurons and necrosis of tissue in the subacute phase. Macroscopically, from mild swelling to liquefactive necrosis and cyst formation. 9. Discuss the causes and clinical features of transient ischemic attacks. Ataxias can be caused by low flow states, emboli from atherosclerotic plaques, and are characterized by transient neurologic deficits that recover within 24 hours. Describe the causes and features of brain atrophy. It can result from age, infections, nutritional deficiencies, trauma, drugs, neurodegenerative diseases, and can lead to cognitive, motor, and psychiatric disturbances. 11. What are the types of brain lesions associated with hypertensive cerebrovascular disease? The lesions include massive intracerebral hemorrhage, lacunar infarcts, slit hemorrhages, and hypertensive encephalopathy. 12. How does cerebral circulation in hypertension differ from normal regulatory mechanisms? Chronic hypertension leads to impaired autoregulatory mechanisms and arteriolar sclerosis in deep penetrating arteries. 13. Describe the progression of ischemic infarction. Ischemic infarctions can involve global or focal cerebral ischemia, leading to a range of changes from early neuronal damage to subacute necrosis, repair, and eventually gliosis. 14. What are the different types of intracranial hemorrhages and their causes? Intracranial hemorrhages include extradural, subdural, subarachnoid, and intracerebral, caused by various factors such as trauma, hypertension, aneurysms, and bleeding disorders. 15. Explain the causes and features of brain atrophy. Brain atrophy can be induced by age, infections, nutritional deficiencies, trauma, drugs, neurodegenerative diseases, and can lead to cognitive, motor, and psychiatric disturbances. 15. What clinical manifestations are associated with hypertensive encephalopathy? Hypertensive encephalopathy is characterized by increased intracranial pressure, global cerebral dysfunction, and may present with alterations of consciousness and severe headaches. 17. Describe the microscopic and macroscopic changes in hemorrhagic infarcts. Microscopically, hemorrhagic infarcts are similar to ischemic infarct with added extravasation of blood and hemosiderin-laden macrophages. Macroscopically, they present as cavities with surrounding glial fibers and connective tissue. 18. What are the causes and clinical manifestations of transient ischemic attacks? TIAs are caused by low flow states and emboli from atherosclerotic plaques. They are characterized by transient neurologic deficits that recover within 24 hours. Explain the pathological changes associated with brain infarctions and their progressions. Brain infarctions involve a range of changes from acute to chronic stages. including necrosis, inflammatory responses, repair, and eventually gliosis. 20. How do different types of cerebrovascular diseases lead to distinct lesions and symptoms? Thrombotic occlusion, embolic occlusion, and vascular rupture result in distinct brain lesions, leading to specific clinical symptoms based on the affected area